Atrial fibrillation is a common rhythm. It's seen frequently by heart specialists. It's also seen frequently in ordinary medical practice. It is a rhythm that involves the upper part of the heart. The lower part of the heart, the ventricles, which are the main pumping chambers in the heart, are generally unaffected. Its main importance is the lack of normal regularity of the heartbeat and the lack of contribution of the upper part of the heart. In atrial fibrillation, the upper chambers, instead of contracting normally like this, can just wobble. And this wobbling motion doesn't move blood. Now that would be catastrophic if the atrium were critical to survival, but it's not. Nature put it there to make the heart work more efficiently, but not to make the heart work itself. The condition, because the upper part of the heart is not critical to survival, tends not to be directly life-threatening. However, there are consequences. When the upper part of the heart doesn't contract normally, blood isn't carried through the chamber rapidly, and it may sit and settle and pool in the small nooks and crannies in the wall of the atrium, little outpouchings in the tissue of the atrium. And if that happens, occasionally a clot may form. And if such a clot forms and it breaks off, and it travels somewhere critical, such as the brain, can carry the risk of stroke. And so one of the major reasons that we want to evaluate and treat patients with atrial fibrillation, going over and above the symptoms, is to minimize that risk of stroke. And with current therapy, that's possible to do with very, very high success rate. Our secondary concern is to alleviate symptoms, and often the most straightforward way to do this is to restore the heart to normal rhythm, and there are tools to do that. In addition, in some patients it's not possible to return to normal rhythm, yet it's possible for you to live normally this way with simply controlling the rates so they're not excessively rapid.